Honestly, what most of us think of as a hygienist is someone that cleans teeth, does perio treatment, but the best practices, they're not focusing on keeping their hygienists as teeth cleaners. They're focused on how do I build a partner in my practice who's helping me diagnose, enroll patients in treatment, and being a second set of eyes, or the original set of eyes, seeing what's going on in the patient's mouth to help them enroll in the dentistry that we need to do. So what's the difference between a hygienist who's focused on cleaning teeth versus a hygienist who's focused on being a restorative partner in the practice? The one that's cleaning teeth, they're checking in on the clock, they're trying to see how fast can I get teeth cleaned, how fast can I get a patient in and out, because I'm trying to make the value of my $80 cleaning. The hygienist who's a restorative partner in the practice is focused on what's going on in the patient's mouth, how do I create awareness, how do I find out and help them see what the options are and to see if they're ready to move forward with treatment. That hygienist is the one that's going to move your practice further, faster. I get this all the time from hygienists. What role do I play in whether or not treatment is accepted? And what I'll always say, the hygienist is one of the most important people in enrolling patients in treatment. Whether that's perio treatment, whether that's scaling with inflammation, whether that's restorative treatment, whether that's implants, regardless of what's going on. And here's why. The hygienists spend the most time with every single patient in your practice. They're spending an hour with that person. They should be developing trust. They should be seeing what's going on. They should be finding out what's been holding the patient back. When you help your hygienist see that value and see and understand how to enroll patients in treatment, your practice will skyrocket. Honestly, the biggest mistake is they're not training them. Honestly, if you think about it, when's the last time you sat down with your hygienist and laid out what you want them to do, not from a cleaning, not from a perio perspective, but from being a partner in enrolling patients in treatment? You've got to get on a cadence of training. Yeah, so, beyond sitting down with them and setting the vision, you've got to go through and role play what's going on. For me, that's always in the moment training, never in front of a patient. But when something doesn't go right, or when you recognize something in the mouth that you say, hey, my hygienist should have known or seen that, that's when you sit down right after the patient leaves and says, hey, this is one of those situations where I would have loved for you to have recognized this and made this recommendation to the patient. So the core thing that every hygienist needs to be taught and doing is taking photographs. Photographs allow you to show and tell, share with the patient exactly what's going on, allows the patient to be involved in what's going on. And honestly, when you hear from your hygienist, I don't like talking about treatment, I don't like doing that, put the photo on a TV screen and the patient will start picking it out themselves. So what should every hygienist be taught or doing? Here's what I've learned. When I brought the hygienist in to watch me do a procedure, they learned about that procedure and they no longer had that lack of confidence. When a patient said, well, what is a dental implant? Most hygienists don't know how you do dental implants. But when they can watch you do implants, when they can ask the questions from their end because they know what the patients are asking, then they'll start getting that confidence, get those repetitions, and most importantly, they'll be talking about it the way you do it, not the way they're taught in some dental hygiene school. So what's the easiest thing we can do when it comes to photos? Here's what I hear all the time. Like, we train hundreds and hundreds of practices. Is my hygienist doesn't know how to take photos, my occlusal photos aren't good. Look, if you're just trying to get started, start with the full face, start with the smile, put it up on the screen and see the magic that starts happening. Now, here's what's key. Intraoral cameras, those little wands you put in the patient's mouth, those are dead. They have no business in a modern dental practice. Instead, we want to be using extraoral cameras, retractors, and mirrors to take high quality photographs. Because one, those photos you can zoom in on, it allows you to zoom out and show the patient everything that's going on, but yet zoom in and see the specifics of what's going on. Secondarily, you can use those in marketing and social media. Hygienists are trained to be reactive, not discovering what's going on. Oftentimes they'll ask the question, does anything hurt you? Oh yes, I'm sensitive here. We'll focus on talking about that. Really what happens is a great hygienist will talk about all the different things that are happening, say this is what I recognize, this is what I'm seeing, hey, this is what another patient who had this looked like, I want you to get this taken care of before it becomes a bigger problem. That's discovering and being proactive, and the discovery part of that is asking them what's going on in their life. How do you feel about getting this taken care of? How do you feel about doing this right now? What would hold you back from doing that? I train my hygienist to use. Most of our patients do this. Many of our patients have seen this go on because nobody wants to be in all by themselves. They want to do the herd mentality. The other thing that I use all the time is the family analogy. If you're my brother, if you're my sister, I had my own dad or my mom had the same problem and Dr. A took care of this for me and we've never looked back. Those analogies, the most many, and the family analogies work wonders for trust in your practice. Nobody's tracking anything. We're tracking production from hygienists, we're tracking perio production, but we're not tracking how many people came in with crooked teeth, how many people came in with missing teeth, what did we do with them, what happened, how many of those got a plan, how many of those got a financial menu, how many of those did we do any type of follow-up with. The opportunities beyond perio, beyond cleanings, is where the real value is at in dental practices. So to me, what hygiene metrics really matter? Of course, there's the basics. There's hygienist production, it matters. Hygienist perio in production, it drives the production, those things matter. But for me, it's how many patients did you refer to me for ortho? How many patients did you refer to me for implants? How many patients did you refer to us for sleep apnea treatment? Like, those are the numbers that matter, because those things drive practice revenue, drive procedure satisfaction. Those things will win in the long run. And honestly, the biggest mistake that we see all the time is the doctor and the hygienist train separately. And then we wonder, why aren't we getting the result that we want? When you go over here to learn clinical and he or she goes over here and learns how to do more cleanings, nothing is matched up. You gotta go together. You have to learn each other. That may mean as a dentist, you have to go sit through a perio lecture. It's the cost of moving your practice forward. As a hygienist, you may have to go through and learn through a dental implant or a cosmetic dentistry lecture. It's the cost of learning so we can help our patients get the care they deserve. The follow-up from this is, how often should doctors, hygienists, and honestly all team members be training together? What we do at 3D Dentist is we believe in a 3-hour training coaching session every single month where the team gets together, and then we have pods of assistants, pods of front office, pods of hygienists, where we're doing clinical calibration every single month. So the question I always get from this is, what do we do? A meeting is not a one-way thing like, hey, like I'm doing right now. I'm presenting to you. A good meeting is a conversation. A conversation involves two people. You know, one says something, another person says, here's how I feel about that. And then it's role playing. Pull up a patient you saw this week. You put up the picture and say, what do you see? Tell me what you would diagnose here. Number 2 is, what treatment would you recommend? And then number 3 is, how would you find out if the patient is ready to do that treatment? Like, that's a perfect hygiene meeting, clinical calibration. So listen, here's what no one is telling us, is they keep trying to say hygienists should be 25, 30, 40% of practice revenue. That's not how I look at it. The hygienist is a partner in your practice. We are not going to get to a point where the cleanings with insurance fees justifies what's going on. It is going to be, at the end of the day, how do we get our patients to do the care they need and the care they want, and how do we partner together to make that happen? Look, all of these things I just talked about, they come from experience. I've been practicing 27 years, own a practice with multiple dentists, still work in the chair, still do hygiene exams. When you have a hygienist that is a partner in your practice, that sees things the way you do, that communicates the way you do, your job becomes easier. Many of you ask me, how do I get people that have an ownership mentality? It's not born, it's created. And so when you train with your hygienist, when you get involved, when you show love and respect and care for them, you will see your practice skyrocket. Did you like what we just talked about? Does this resonate with you? Then listen, this is what we do in our 3D Mastermind program. We have hygiene boot camps and we have team training programs that are exactly this. How do we get the doctor, how do we get the team, how do we get the hygienist in a room together, rowing in the same direction, speaking the same language, so that the practice, the patients, and the team members can win? Click the link below. We'd love to have you apply and see if it's a good fit.